This segment is sponsored by Copare Health. In the world of weight loss, GLP-1 medications are making headlines, but they're not a one-size-fits-all solution. Nutrition still plays a crucial role in the journey. Here to explain why is Dr. Kim Spivak, a certified health coach with Copare Health. Welcome to Great Day Washington. Thank you so much for being here.
Oh, thank you, Elaine, for having us.
Of course. Well, help us understand how your program is different from others that offer GLP-1 medications.
Well, first of all, we've been in the DC area since 2016, before the FDA approved those medications for weight loss. So we were working with clients for a long time, just based on their nutritional needs. So we continued that process. We just included the GLP-1 medications as an offer to help support their journey, but we coach them all the way. So we want to make sure we understand their goals and also their body composition at the beginning. And we help them put systems in place for their life that will help improve their health. We balance checkbooks, we take care of our kids, we do a lot of things, but sometimes our actual health and our planning and preparing meals and so forth, that gets kind of pushed aside. So we just help people realign, organize, evaluate what they need, and put a good system in place. We also teach them about nutrition and their body composition. I encourage movement, and we meet with them every week. Oh, wow. So we're tracking them throughout the journey.
Yeah, that's so true. Sometimes we put our health kind of on the back burner and do everything else, but it sounds like you have a plan and a program for patients all along the way. Now, are clients working directly with physicians during the process?
If they are going to choose the GLP-1 medications while they're working with us, absolutely. They would be supervised by a medical physician while they get their coaching. So the doctor meets with them initially and does an intake, explains how the medications work, make sure they look at their medical history, make sure that it's safe for them to utilize, and then they have periodic check-ins with our partner physician as we're coaching them weekly.
I see.
Yeah.
You mentioned how they work. Can you explain to us exactly how they do work in the body?
Yeah, actually they mimic a hormone that humans already produce, but the half-life of what we produce is very short, like it's in minutes, and it produces a feeling of satiety. Also, it slows the gastric emptying when we're digesting our food a bit, so we feel fuller longer. So the scientists that figured this out, it was back in the 1990s actually, that they could replicate what we already produce and change it to mimic that same hormone, but the half-life is more like a week long. So those feelings of satiety and the cravings that we would normally have go away, so to speak. So it's a once-a-week injection right now.
Once-a-week injection, okay. Can someone participate in your program virtually?
Absolutely. Oh. You know, people are busy, right? And even our local clients sometimes travel for work or just can't get into the office. So we send them a bioimpedance scale that they can use right in their home to monitor their body composition. We have clients all over the United States, and a lot of them do choose that virtual option. So we still do our weekly coaching and food planning and things like that, just remotely.
Wow.
Yeah.
I imagine you've seen a lot of success stories.
Absolutely. That's why I keep going with this. I mean, it's so rewarding. It's definitely been a big part of my life, and I love to help people. So Copare is a great business, but it's also a caring company that just wants to see people be successful and live healthy lifestyles.
Yeah. Well, thank you so very much. Thanks for being here.
Thank you. I really appreciate it. Great to meet you.
Great to meet you too. To schedule a free consultation with Copare Health, just head to coparehealth.com.